excited to be joined today by Dr. Neil Paulvin, who is based in New York City. He has an amazing practice that specializes in anti-aging, health optimization, and biohacking, and he works with athletes, celebrities, Fortune 500 entrepreneurs. And today we're going to get into a lot of different areas of brain health optimization. We're going to dive into some peptides and also into longevity. So first of all, Dr. Paulvin, welcome to the show.
Thank you. I'm happy to hop on here and have a great conversation.
Yeah, I'm excited to kind of dive into the detail. So let's start, because I've had some specific requests. I haven't covered peptides on the podcast before, and so I have been getting some requests to cover this. Can you, first of all, if we just start to break it down kind of quite simply for people, give them a sort of an overview of peptides and why people might want to start using them?
Sure. Peptides have become huge in the last year or so. Peptides are usually small complexes of amino acids, could be as small as 3 or 4 up to 5. There's some that are over a couple hundred in length. They work on specific areas. They may work on a specific hormone. They may work on a specific enzyme pathway. They may work on a specific area to achieve a lot of different results. The list is probably 50 different things now. The main things that I use it for, I describe it to people, is really about 4 to 5 different buckets. It's definitely, there are 3 or 4 that really work well for gut health. There's about 5 or 6 that work really well to help either to help an injured brain or somebody who has brain fog, or just optimize brain health for those people who just want to have their brain like an 11. There's a great bunch of them for recovery, for sports performance and recovery. Then there's the other bucket is for anti-aging longevity and work on the mitochondria. And then the last bucket is what I call the vanity peptides that work on hair loss, erectile dysfunction, weight loss. So that's kind of where they go. Another question I always get asked is, it's not just injecting yourself anymore with this needle, and people don't like needles, is you can do them as a cream, a nose spray, there's hair foam, there's nose sprays, there are pills. So you can take it in varying forms. Certain ones work better in certain formulations, but it's not just something you have to inject yourself with.
Okay, amazing. So that's good to know, because I know a few people that have been asking questions ahead of this interview when they knew you were coming on actually don't necessarily want to inject. So first of all, let's look at brain optimization. It's a specific interest of mine, and I know it is of many of the listeners. I'm always trying to get my creativity and focus really dialed in. And also, as someone who carries 1 copy of APOE4, I'm really focused on kind of how to keep my smarts and prevent things like dementia. What kind of peptides and in what formulations can you use to enhance, like effectively using them as nootropics?
There's a bunch. There's one that I love. It's probably easier to get actually in Europe than it is where I'm at in the US. Something called Cerebral Lysin. Cerebral Lysin is like the holy grail at this point. It works on many different things. It has a neuroplasticity effect where it can actually boost neuroplasticity. It helps inflammation. It acts as a nootropic. So it does like every check mark you'd want to boost your brain. That one is derived. It's originally derived in Russia. It can be optimally is either done as an injection for like usually a cycle of about 20 days, several times a year. Or, I mean, a lot of times in my practice, I'll also do as an IV. When we'll do that same time, like 2 or 3 times in a session, and then we have them spread out unless somebody's doing like a traumatic brain injury or something like that. We do it over a longer period. Some of the other ones are a little easier to use at home would be something called CMAX or C-Lank. They both work on some of the neurotransmitters in the brain. They're both nose sprays. They're kind of on the lower level. They're like a 2 or a 3, I tell patients. They also help with a little bit of brain inflammation, but mostly they work on working on the neurotransmitters. Then you have the other stronger one, which is something called dihexa, which works on the angiotensin system. It's usually done as a cream, which is great. So again, you don't have to worry about injecting it. I usually do it for a month or 2. It's great as a nootropic, as for patients who have brain fog. It also helps with, again, I use it a lot of my patients who have like a traumatic brain injury or Lyme disease or fibromyalgia, because it works on both groups of patients, which is really incredible. It's usually one of the ones where I see the quickest response. And then you can combine it with things that are not quote unquote true peptides, things like NAD, RG3, which is the ginseng derivative. People are now loving oxytocin. The love drug is also can be added in there as kind of complementary. So that's really the core set. And then then that's really the ones that we're using for brain right now. One of the ones you mentioned before, BPC 157, is also helpful in terms of brain health because it helps with decreasing inflammation. It may help a little bit with neuroplasticity as well.
Okay, cool. So on those, the first one that you mentioned, you were talking about doing it on like a few times a year on a 20-day cycle. What does that involve? Does that involve a patient coming in and having injections daily for 20 days, or what's the routine around that? Are these in clinic delivery? Obviously not the creams and the nasal spray.
No, I have one or two patients who are local who have the time to do it. Most patients who do that are the ones who are very comfortable injecting themselves. So usually more advanced patients, advanced biohackers, or just patients who maybe be unfortunately diabetic or something where they're used to doing the injection. So they're usually doing it at home. The only time that I'm doing the injection would be if they're in the office or something else, or it's also happened to be really great for like tendinopathy and sport injuries. Like I had a bad hamstring issue. I injected myself in the hamstring and within 2 days it was pretty much gone. But otherwise, most patients are self-injecting it.
Okay.
It's just
and
much
so you
easier that
basically
way.
send it to their home and then they do it themselves?
I either give it to them in the office or I send it to their home. I do that with a lot of the ones. A lot of my patients, once they get started and they get their program going, I'll mail it to wherever they live and they just run it with it from there. They get the needles and they're just on their way.
And in terms of like how often they need to do that, so for example, they would do that a few times a year basically to boost the effects, and how quickly would they expect to see some of those benefits taking place?
I mean, most patients of mine will do it 2 or 3 times a year. Some will do it as part of a lot of at least more and more commonly, I have patients who are doing like an anti-aging stack 2 or 3 times a year. They'll combine with some of the other peptides. They may do some like senolytics or some other stuff you may have talked about in other shows, or mix it with like an NAD type booster. So they usually do about 2 or 3 times a year. I know when I've done it, a lot of patients get a really quick result. I mean, it may be a couple days, and they'll really start feeling it in terms of the brain effects of it. I've had patients who have taken maybe up to a week, but usually after the first, maybe the second dose. I mean, sometimes we do what we call a loading dose, where we'll taper the dose up a little bit every time I see patients. They usually will definitely feel it pretty quickly, at least after the second dose. It's working.
Yeah, you know it. And are there any kind of side effects that they can expect? Are there any kind of contraindications, people who can't take it?
Not really any side effects. You will get a little flush, like if anybody who's out there is ever taking like niacin or just had some type of reaction, or NAD will have that flushing sensation sometimes. Not from niacin, but they feel the same way. You have to go pretty slow with it. Otherwise it may be a burning sensation. But not really any contraindications in that regard. It does come from pig brain. So anybody who has an opposition to that or for religious reasons, that's really the only contraindication. Because some patients just don't want to take anything from an animal, but otherwise, no.
Otherwise, there's not. Okay. And you mentioned there as well, in terms of like anti-aging, for example, and you can use ones that are creams, they can help with hair loss, they can help with skin health. What are the effects that you've seen then in terms of people? I guess there's two things, right? There's the kind of skin health aspect in terms of actually looking younger, and then there's kind of the inside out where we're actually seeing people reversing biological age. I know that some of them have been linked, for example, to telomere lengthening. Can you just explain a little bit more for people how that works?
Sure. We'll do it systematically so it makes it clearer. Is that, yeah, definitely there's some cosmetic peptides for skin health that are done through microneedling in terms of just strict dermatological procedures. One is GHK copper. Another one is called, which is really good for inflammation, to deal with collagen buildup. And that you see pretty regularly. I've also had patients who have had acne or some type of skin rash, and you do one of the skin peptides and it does decrease, makes it go away. Then you have what they now are calling, quote unquote, the Botox peptides. They're not totally equivalent to Botox, but they if you mix that in with the GHK, it does give you some benefit, especially if you do the microneedling, get it when you do get any type of skin microneedling done. And then there's a couple other minor skin peptides. And again, so that's the more external ones. TB4 and thymosin beta-4 and BPC are also used for hair procedures, as well as a couple of the other ones, including GHK copper. So that's kind of the external. The internal, there's a bunch. I mean, I'll go kind of pretty simply with them. I mean, the one I know you mentioned telomere length. That's what's called the Pidolon. That was pretty popularized by a doctor in Russia who I'm missing his name off the top of my head at the moment, but that's also done in usually a 10 to 20 day cycle, depending on how you want to do it. I have my patients doing it every 3 days for 15 days at a pretty high dose. And that, again, will help with anti-aging, helps with oxidative stress, helps lengthen the telomeres, also helps work on the pineal gland, which regulates your part of your circadian rhythm and helps with your sleep. So it's got a lot of wonderful effects with it. There are now a bunch of mitochondrial peptides. Mitochondria, for those who don't know, is the energy part of your cell, it's your battery. So if it's been affected, diminished, then it's going to cause a lot of different issues. Now there's been studies linking it to Alzheimer's, Parkinson's, if there's damage, inflammation, what's called oxidative stress, which is inflammation from free radicals that are fighting off toxins and other things. So there's a bunch of mitochondrial peptides in the last year have been shown through studies to in theory, boost increased lifespan. One is called MOTC. The other one is SS31. SS31 is really gotten the most publicity at this point, in the sense of that it does work on as an antioxidant in the mitochondria and helps the cell. It also has been shown now, we're using it now in patients who have Alzheimer's and Parkinson's. MOTC works on the AMPK system, helps boost insulin sensitivity, and also may help with longevity. The other ones that are used for longevity is something called thymosin alpha-1 and thymine, which work on the immune system. And those are pretty much, and cerebral lysin also, like I said, is used for anti-aging. So those are the 6 that we use kind of as the core for anti-aging regimen, with a whole other protocols as well.
Okay, super interesting. And so what about, for example, I guess just to sort of make it a little bit easier for people to understand, say, for example, I know you do a lot with hormone testing as well. If we're looking at women, first of all, in sort of perimenopausal women in their late sort of 40s, early 50s, what would the kind of stack be that you would recommend for someone like that? So often they've got difficulty sleeping, they're having hot flashes, they're maybe experiencing some brain fog. They feel like they're getting that loss of collagen in their skin, where estrogen levels are going lower. What kind of thing would you recommend?
That's usually a combo. It's usually a combo of traditional bioidentical hormones or supplements. That's usually a bigger portion in terms of women's health. A lot of times, like you said, we will give them some skin peptides like the GHK copper to help with the inflammation. We can give them a Pidolon to help regulate their sleep if they're having sleep issues. There's also a kind of the offshoot of what's called peptides called bioregulators, which work on specific hormone systems that are kind of the cousins of peptides. Some called pineolon, which works really well for sleep as well. A little bit easier to use than the Pidolon. We use that. And then we also definitely will use either BPC or thymosin beta-4 to help the patients as well. That's going to help with brain health. That's going to help with their brain fog. It's going to help with any joint pain or gut issues they may have. It's also been shown, the BBC especially been shown to help with some female issues in terms of like hormone dysregulation. So that's kind of where we start. Also, BBC is great because it does help with kind of the anxiety, depression. It works on serotonin and dopamine. So if there's any mood issues, anxiety or insomnia, it works. It's a nice little add-on. It has like really very few side effects with it. So it's definitely a go-to for female health as well.
This is the BPC 157.
Exactly. Yes.
Yeah. Okay. And that in itself helps with gut health as well and lowering inflammation.
Oh yeah, it's wonderful.
Yeah.
I mean, I've had patients with chronic gut issues. We start them on that either as an injection or orally, and within 2 months, a lot of them will feel better, And I've had a couple of patients who have had a colonoscopy right before they started it, and then a colonoscopy afterwards. And their doctors are like, "What did you take? Your gut looks so much better. There's less inflammation. You have like Crohn's or ulcerative colitis. It's helped heal it, at least partially, if not completely." So it's really great for gut health. Another one that's kind of come on the scene is KPV, which works on a TL4 receptor, which is also really great for gut health. A lot of times we'll use that for patients more of like either a candida overgrowth or a SIBO, which is small intestinal bacterial overgrowth, and it works really well. It's also really great for psoriasis. So we'll throw that in there as well. But gut health is something that I've had really good success with when the other things haven't worked.
Okay, amazing. So that's the one that you would use for SIBO, is it? Because I had a question around that. Are there any that would help with SIBO?
I'll usually start somebody on KPV, and then I'll also add in LL37 afterwards. That has to be done really slowly with most patients because a lot of patients may react poorly to it initially. They may have it's not a traditional Herx reaction, but it's a release of inflammatory chemicals. So you want to kind of really go slowly, but it works really well for patients who can tolerate it.
Okay. What kind of reaction would they experience with that then when you say it can be a bit inflammatory? Would it affect their bowel movements? Would it cause gastric discomfort? What would they expect?
They may get a little discomfort. They may get a little like a flush sensation. They may get a little bit of brain fog. They may get a little bit kind of like body aches, I guess you would call it. Mm-hmm. So you can get all those symptoms. Some people have a really bad reaction to it because you're killing off an infection so that the body's just getting rid of it. So those toxins are being released into your system. And if your system's not ready for it, then you'll kind of feel like you have a mild flu or just like some body aches for a day or two. I usually prep patients beforehand for it, give them some supplements to take before. And it's really not usually an issue as long as you go slow.
Okay. And on the BPC, just going back to that, because that sounds like a pretty wonderful one in terms of its all-round ability. What's the best way for people to have that? Is that both in oral form and injectable? Does it make a difference?
I tend to, unless it's a very local injury, like if you have a rotator cuff tear or like a knee sprain or something like that, I still tend to recommend doing the injectable. I just find that it gets everywhere better. If it's a local area, then I'll either inject it like you would have a cortisone shot. It's the same thing, or I'll have the patient inject around that area if I feel they're comfortable doing that. Or that otherwise I'll have them either do, if it's a local area, or they're having a gut issue, I may have them do orally if I feel they can absorb it. There's also a cream for local injuries as well. But 80% of my patients start on the injections, at least, as long as they feel comfortable to do it.
And how often would they need to be injecting with that one if they were to go down that route?
Is
that on a cycle, or is that something that you use on a continual basis?
How do I answer that? Most patients do it daily, at least for 6 weeks to 2 months. At least 6 weeks if it's like an acute injury. If you're trying to do a gut health, I usually have patients on it for 2 months daily. That's usually, and then I have patients who've been on it for 6 months. I have patients I have hardcore athletes and trainers that just abuse their body, and they pretty much will do it for about 4 to 6 months straight. I'll have them take a month or two off and kind of replace it or do nothing, and then go back on it because they just find the recovery is just incredible. And
amazing. And are there any kind of downsides for people that want to start? As you say, it's really kind of come into its own in the last 12 months. It's pretty new. Like, how much do we know about this in terms of downsides?
It depends which ones you're talking about, because a lot of them, the downsides are, especially I see unfortunately in the patients who have chronic illness more than the optimizer or the biohacker, because unfortunately their immune systems and their inflammatory systems are just not as good, and you have to go a little slower with them. They may get an anxiety reaction, or they may get inflammatory throughout their body just because their system can't handle it. You usually have to either switch them to every other day, or there's some that just can't tolerate certain peptides. In terms of the regular ones, the ones that the general public would have any type of downside with are the growth hormone boosting ones. We have to be really careful. We can get really what we call hangry, where you get hungry and a mood swings potentially. So that's one you really want to make sure that you're not doing on your own. You definitely want to make sure that you're following with a health practitioner who knows what they're doing with it. That's the major one. I'm trying to think. Thymosin alpha-1, the immune system peptide, which is really great for viral illnesses and other things. That one, some people may also have kind of like a reaction with either not rash, but a flushing sensation or some myalgias with it. So again, that's something that we have to be careful with. Otherwise, most of them, I'm trying to think. Honestly, there's really not a lot of downside for most patients. Trying to think. The hair ones, no. Yeah, the skin ones, no. Yeah, pretty much. The other ones that there is an issue with are ones we haven't gotten into. They're called their work on the melanocytes. They used to be called the tanning peptides, and we've kind of gone away from them a little bit. But they do help with weight. There's what's called PT141, melanin tan 1 and 2. They initially were found because they would give people a tan. So in the summertime, instead of people going to the beach, they just wanted to get a tan. And now we found they're really good for brain function, as well as sexual function, where you may get a really bad irregular tan if you take too fast or the wrong dose. Most people, look really tan, and you can be very spotty. So that's the other one that you want to make sure you're working with a doctor with.
You may get what? Sorry, you may get too tan. Did you say?
You get like really, if you're somebody like who's, I don't know if you can, who's very has a very white skinned or pale skinned person, you're gonna get very dark, very potentially quickly.
Wow.
And
but all evenly dark, or could you end up with some like potential pigmentation issues? Or
that was the next thing. Yeah, you can get a spotty issue. And again, I'm on the paler side, so I make sure patients who are on the paler side know that going in, especially since it's what's called one I mentioned before, KPV doesn't really have those side effects and gives a lot of the same benefits now. So you don't have to worry about that unless you do want to get tan. But it's not like going to a tanning bed, or I don't recommend tanning beds if you're doing things more naturally. So that's the other one that has the other major side effect. But most of them are luckily pretty clean, and that's what's great about them compared to prescription medications, because you don't have to deal with many side effects. That's why they're getting more and more popular, because they work really well and have less side effects.
And in terms of like skin health, you were mentioning like some of them work better with derma rolling and things. Are they topical ones that you would put in then? Are they being injected into the face, or are they like a cream that you could basically incorporate as part of your skincare routine?
They're all creams. They either come separate or together. So there are a lot of women, even now I have men using it as part of their skincare routine, depending on what they're trying to do. If they're just trying to look younger, trying to get rid of wrinkles, if they're trying to build up some collagen naturally, if they have some redness, especially like around in the cheeks or around the forehead, they'll use that as well. But they're all used as cream formulation. So, and a lot of patients like it. Again, it's something a little bit simpler to do sometimes than having to run to the dermatologist or plastic surgeon and get their Botox or filler and things like that.
Yeah, and potentially better for you as well, right? Than putting something like Botox in.
Yes, definitely.
Yeah, exactly. Interesting. And okay, so in terms of like, you mentioned as well there that there are some that can enhance sleep. What have you seen with that specifically, and how have you sort of measured it? Have you seen that their time that they're sleeping, are there less wake ups? Are they getting better quality in terms of like slow wave, deep sleep? Is it increasing REM sleep? I imagine there are differences, but I'm just curious in terms of what kind of benefits you can get in terms of sleep optimization.
You get all of the above, depending on which ones you're using, and it depends who you're using it in. I mean, I've had patients who have been on the growth hormone peptides, which are CJC, ipamorelin, IGF-1. People may have heard of MK677. They all are going to help with sleep, as part of growth hormone does, especially if you're taking it at night. Where they'll tell you just qualitatively, yes, my sleep is better. And then some patients have actually checked it on whatever their wearable of choice is, Whoop, Oura Ring, whatever, and the data actually backs it up, where they're getting deeper REM sleep as well, and they're getting longer REM sleep. So that has been proven both ways. Then you have the ones, like I mentioned before, that work on the pineal gland, which work more on regulating the circadian rhythm, which I use more in patients who have chronic insomnia, who've tried like everything else known to mankind, from melatonin to theanine to whatever else they happen to be using. And It's worked more than 50% of the time, especially I mentioned Pineolon. It's a low dose. It is an injection before bedtime every day, so patients will tend to use it only when they having those really tough nights. But it's also that's not shown as much quantitative data like on a wearable. But a lot of patients have said, "Hey, my sleep's 50-60% better just by taking this at bedtime." Plus, you add in like really good sleep hygiene with it, and it works. So it depends on who you're talking to. There's people who just want to take it just to have better sleep than they already have, so their Whoop score is better, and there's people who actually have chronic medical issues like insomnia. So it works for both of them.
And when it on the one that you mentioned there that works on the pineal gland, could you use that in terms of accessing more of a kind of flow state, getting into a deeper meditation? Could you use it for that purpose?
People have tried it. It's not a lot of great success. I know people have done it with the Apilon more. It helps a little bit. It's not what I primarily use it for. That's usually more the technology or just other things that you would potentially use for it. That's not really a go-to for it, at least from patients I've talked to so far with it. They get more of that with like a NAD or something like that, or other supplements that are out there. So that's not a go-to for it.
They've enhanced their meditation with NAD?
NAD, because it helps the circadian rhythm. Okay. They may use other things as well. But some things that are a little more, I'm not sure in where you are, mushrooms are legal or other things they're using, but they're using other things that have just more bang for the buck than
using psychedelics.
Psychedelics or things like that work better for them to get into that flow state, theanine or other things that work better.
Yeah, which are not legal here, mostly in the UK, but very interesting. Okay, and have you, in terms of the anti-aging benefits, I just wanted to look at with you, is there like a particular, because there's quite a few on the market at the moment in terms of assessing biological age. Have you been doing any of that where you've looked at people's biological age and then actually done any of these protocols and actually looked at the effects later and seeing whether there's any reversal? And I'm just curious as to which kind of biological age testing you might use.
I'm a bigger fan of the True Diagnostics. I like it. I think it has the most data behind it. So I have patients who are doing it. I'm right now in between my first batch and their second test. So I haven't been able to document, okay, you're on this anti-aging regimen, look at your scores. Because so I'm really curious to see that. That'll probably won't happen for a couple months yet, because a lot of them just started doing the first test the end of 2020. So that regard, there's not as much like a wearable or testing proof yet to it. I know patients have said they feel better, they have more energy, they say they have more clarity with it. So I've got qualitative evidence that it works, especially the people who do kind of the full protocol as opposed to kind of dabbling in it. But even the patients who do one or two things usually have positive things to say about how they feel afterwards, but we're still trying to work on, I'm not a huge fan of there's just a strict telomere testing. I find that do different tests, they kind of have different results. So I'm kind of figure out what I'd love my go-to is for a telomere test, but in terms of the biological age testing, I'm going to wait in. I think the True Diagnostics will give us some really good information.
Interesting, because there seems to be a disparity when people do these tests in terms of what age they can get. If you look at comparatively, say between glycan age versus tele years versus some of the others like the methylation tests and things, some of them can make them years younger, and then others they come out and they're very close to their chronological age.
Yeah, exactly. That's why I'm still playing with them. I have patients who have heard about them on other podcasts or read them online. They just do them, and there's no set data which one's the most accurate. So we're still learning that. I think if you really want to, you need to do one or two tests just to get a consistent answer. I like the ones that are based more on the methylation clocks. And there's a couple more coming out this year, supposedly, that may even be better than the ones that are out there now that have actual real data behind it. I know Horvath has another one coming out who's kind of one of the inventors of the methylation clock. So I think that's the one where it's going to take some shaking out to really see which are valid and which are kind of just not that great information.
Yeah, sure. And on the recovery side, like you were mentioning in terms of recovery with athletes, you work quite a bit with athletes and things like that. Have you noticed that any of these, or anything, I guess anything that you're doing really, is really able to impact HRV, either in athletes who maybe are experiencing overtraining, or commonly what I'll see with, is with entrepreneurs, for example, if they've been pushing themselves too hard, and other kind of executives and professionals, then it really starts to impact their HRV. And when it's consistently low, it becomes a lot harder to sort of move it up. What have you found in your practice has helped to sort of move the needle the most on that?
In terms of HRV, I mean, really, it's when two. It's some of the, like a Cmax or C-Lang, that has been shown to, they're not shown, but it helps in terms of calm them down, which calms down their sympathetic nervous system. The other one that I found, it just kind of anecdotally, is the BPC 157, because it does have both the mood issue, not the mood issue, but it affects the brain with the serotonin dopamine effects, plus it's decreasing inflammation. So both those things should definitely help to raise your HRV. It hasn't been, I mean, there's no clinical studies showing that any of the peptides will reset the HRV. Also, the ones that work on the pineal gland, the epithalon and the pinealon may help as well. But again, that's all kind of anecdotal at this point.
Yeah, because you're still something kind of it's just so new. Okay. And I guess, so I'm just trying to think how I sort of phrase this. I guess, so if you were looking at somebody who is at the moment, like they're feeling really overstretched, like a lot of people at the moment, it's been a crazy year last year. The start to 2021 hasn't been without it's bumpy, it's bumps already in terms of a lot of people are kind of locked down. A lot of people are struggling with mood issues, for example, and also just general anxiety I've seen in many people has gone up. Is there anything that you're on the peptide front that you're finding is helping with that? And are there any contraindications, for example, for people who are taking any SSRIs or anything like that?
Not with the peptides as much. I tend to watch them because they may not need as higher dose as they did before. I tell them to make sure if they're on psychiatric meds, to make sure they let whoever's prescribing them know, but not really major side effects. I use either the C-Lang or the C-Max as in terms of the anxiety component and the mood component. I had a lot of them on the BPC 157 again, because just of all the benefits that it has. It's going to help heal their gut if there's any type of gut issues or stress-induced issues. It's going to help increase energy because it also boosts nitric oxide. There's a lot of other things in the mitochondria. It also is going to help in terms of the brain. So it's just such a wonderful, it checks off all those boxes for patients. I mean, that's usually a good place to start. And like I said, if they are having sleep issues, then we add in some of the sleep ones. Another one I didn't mention is called DSIP, which was deep sleep inducing peptide off the top of my head, and also helps to kind of regulate sleep. So that's kind of my go-to starter pack with the patients who are dealing with the stress of COVID and what's going on in our society right now. And then we kind of mix and match based on how aggressive they want to be and what specific issues they're having.
Mm-hmm. And have you seen any patients that you've been able to help with these sort of protocols who've had long COVID and who are really, really struggling? Because I know back there you mentioned things like chronic fatigue and fibromyalgia. Have you seen any improvements in patients who are experiencing now long COVID and they're feeling really, really fatigued?
Yeah, so we've had really good success with the patients on long COVID. Again, none of these have, only thymosin alpha-1 has studied specifically with COVID at this point. I know there's initial studies going on with the rest, but just because of symptom base, we've been doing a lot of treatment for the patients who we call them long haulers or long COVID, and had pretty decent success somewhat quickly. We use the one I mentioned is dihexa, which is great for patients who have any type of brain issue. And any type of inflammatory issues. We're definitely using the thymosin beta-4 and the BPC 157 again. Since a lot of this, unfortunately, is an immune reaction, we're using the thymosin alpha-1 with really good success as well. We're usually using a little bit higher doses. Some of us are doing IV dosing as opposed to just having the patient self-inject. So those are really the peptides that we're using. LL37, which we brought up a little bit before, also has shown some success with the patients as part of our protocol for the long COVID patients at this point. And a lot of them have had just some or all symptomatic relief at this point, combined with some other things that are out there.
And what have you, in terms of how have you combined that then with lifestyle measures? So, for example, because some people are, they're not able to have, obviously this is helping them, but they're not able to necessarily take the time to fully recover. So like, high-level executives or, for example, athletes, what have you found in terms of like lifestyle medicine that you're practicing in terms of helping them get back on track?
Well, specifically with COVID or just in general, or?
I guess two things really at the moment that I see is for people with COVID who've had long COVID, and then also just people who are feeling the stresses and the strain. So obviously anything that you're doing here has to be used presumably alongside a good nutritional protocol,
Yeah.
Full of antioxidants, good sleep practices. But I think that the thing that I've noticed, and particularly when I've worked with companies, corporates at the moment, is sleep's a huge issue, as is the anxiety. But I think where people are overwhelmed, and so many businesses are kind of in that stage of having to pivot quite a bit, the volume of work for most employees has actually gone up significantly. Obviously, there's a section of the population who are on furlough and they're actually working a lot less. But then there's also another section of the population who's working harder than they've ever worked. I'm just curious if, apart from the peptides, have you been using anything else, or is there like a specific stack? You've mentioned NAD that you would put alongside that are just helping people really meet the demands and kind of bring it every day.
Yeah, what we're using is depending on what the situation is. I'm trying to think. One thing that we're using a lot of is melatonin, sometimes at higher doses than people are using regularly, has worked well. Actually, high dose melatonin is actually really good for inflammation taken during the day, but melatonin also may have a specific effect if you do have COVID. There's a bunch of studies going on now to see if it actually will help treat COVID itself. It's definitely become part of the stack. Theanine has become a big part in terms of both with sleep and anxiety. CBD products have become a big add-on. We're using that with.
And is that using like the full spectrum CBD?
Optimally, yes.
Yeah.
If they can get it. So it's used with that. We are using at home, again, there are also, one thing I found works really well if they have access to a red light therapy. That's helping them both regulate their sleep. It's not another medicine they have to take. It'll help with inflammation. It'll help with stress. It'll help with brain fog or just that overgrowth of inflammation they may have in the brain just from trying to process everything. I try to get patients on red light. And then I will also add in, just simple things like, I try to have my patients do some type of mind-body every day, meditation or journaling or gratitude, something, whatever if it's something that they're going to buy into. Trying to think what else I use.
Just to pause you there on the red light therapy, have you found that optimally is daily, basically in the morning? Like some people find it quite stimulating, don't they, using it at night because of the energy enhancements in the mitochondria?
I'll have most patients do in the morning and or by early afternoon. The only patients, it's trial and error. I have some of my insomnia patients, I have them do it at night just because it tends to help reset the melatonin a little bit. If they have exposed to a lot of blue light, if they're somebody who's on the computer hours on end, but usually it's by early afternoon I have them stop it. But daily though, like at least 5 out of 7 days.
Yeah. For what, sort of 10, 12 minutes a day?
Exactly.
Each side, basically.
Depending on what unit they have, yeah. So
yeah, depending on, unless they've got a double, yeah.
I have some patients who go to the bed and they just hop in there for 10 minutes and they're good to go.
What about sauna as well? Or have you found that sometimes in terms of infrared sauna, I know there's kind of differing views because it is healing, but it's also a form of stress on the body as well. Have you found that that's been helping with recovery or helping with managed stress, or is it sometimes just adding too much of a load?
I'm a proponent of it. I know there's some debate in terms of the good. The effect it has on the heat shock proteins and other effects, I think outweighs everything else. Somebody who's who has a lot of issues going on, it's not my first thought. If it's somebody who's more kind of maintenance or prevention, and then I think a sauna is great. I think it's really good for, again, working on the mitochondria, helping with inflammation, helping with the brain. I think it has just enough benefits that will outweigh any type of negative effects. But again, if somebody has really bad long COVID, that's not my first go-to, because it can overshoot and make them worse rather than better. But for my patients who are kind of mild, I definitely, it's another recommendation.
Yeah. And in terms of the NAD, that's being administered through an IV? Are you using any kind of specific supplementation alongside that?
Oh, that's a whole other lecture right there. Let's see. NAD, my go-to NAD for patients who are competent, I either love them doing the patches once or a couple times a week. I just find it's a way of getting the higher dose without them having to come to the office for the IV. I mean, IV is still the best of all the things that are out there if you have the time to do it. I mean, most patients can get it done in about 3 hours, but a lot of people don't have 3 hours to do it right now. The other way I'm having patients do it is either through injecting themselves into the belly once or twice a week. Some people are doing up to 3 times a week. Or now I'm really starting to love the melt tabs that dissolve in your mouth. They work. They're really, really good and have a really good beneficial general effect of the NAD. So, I mean, compared to what was available like a year ago in terms of NAD, now it's a lot higher quality, higher dose, and you don't have to do the IV if you just can't or won't or don't have the time to do it, compared to a year ago.
And you use the NAD over something like NMN, which I know Dr. David Sinclair uses quite a bit.
I've had more patients just do better with the NAD or the NR as opposed to the NMN. The only reason I'll use NMN as part of my anti-aging protocol if somebody's doing the full one, because there's a little more studies with it, about 50-50, I guess. But I've had patients do better with that with the NMN. There's just harder. I'm having a harder time finding how many patients find the NMN the good quality NMN at this point compared to other versions of it. So I'm still more an NR person, but with selected patients, I'll use the NMN. I'm still waiting for those head-to-head studies to come out and see which one's better.
And I'm curious in terms of like dietary protocol, whether you have a kind of format that you recommend for your patients or whether it's very sort of bio-individual.
Oh, it's so bio-individual. I hate the one-size-fits-all diet. I think that makes no sense to me, because everybody's different. Everybody has different demands. Everybody's different lifestyle situations. I mean, I would love to be able to do keto. I would love to be able to do keto, at least cyclic keto. I will bottom out. My insulin crashes. I feel horrible, so I do it as long as I can. So everybody's different for different goals and different lifestyles. I mean, the only thing I have patients definitely doing, obviously, an anti-inflammatory diet, avoiding sugar, gluten, dairy. If they're a chronic illness patient like fibro or something like that, I'll have them try to avoid lectins if they can. And then I love for brain patients, I love that if they could do keto, if possible, at least for a short period of time, at least a couple months, so they make sure they're getting into true ketosis. So that's my recommendation. Otherwise, I'm more proponent of a higher fat, low carb diet, no matter what. I'm not as huge a fan of a plant-based diet. It's just not as much. Some of the nutrients aren't in there as much. But if that's what patients want, as long as they're supplementing with what they need, then I'll do that too. I mainly get the inflammation out, try to regulate the immune system, give the brain what it needs, and then we can mix and match from there. Yeah.
And presumably use relatively high levels, or at least moderate levels of protein alongside that.
Oh, most of my patients are not getting enough protein in their diet, especially my patients who are workout junkies, which a lot of high achievers are. Where they're working out they think more is better sometimes, which actually it's not. I mean, actually, I think you mentioned before, they're overtraining and causing more harm than good. But yeah, no, I mean, I recommend sometimes up to 2 grams a day of 2 grams per kg of protein a day. Make sure they're getting the adequate leucine in their diet. A lot of times they have to supplement to get it. So I want.
So do you do 2 grams per kilo?
Optimally, yeah.
Did you say?
Yes.
Yeah, which is so here we do 1 gram per pound. That's what, and as long as you're getting enough leucine, and then I find as long as they're complementing it with things like kind of more nose to tail, plenty of glycine, things like that? Because I think that sometimes people worry about eating too much protein, but in my experience, most people never actually get to where they need to be anyway. Even when you give them something like a high level, they actually find it very difficult to achieve that, as you say, without supplementation.
Exactly. Yeah. So I'm a big, I mean, if any side effect, that's okay. But if they have some kind of malabsorption or something, then that's a different story. But most patients feel better, and a lot of my patients are seeing me to put on mass and try to boost their workout. So it's not really a battle. But again, like you said, it's a lot of times it's just adding the right supplementation to get them where they need to be.
And just kind of coming back to that in terms of thinking about mTOR, and also when you were mentioning with the peptides, with human growth hormone, do you worry about that, or how do you sort of regulate that?
That again, there's another rabbit hole to go down. There's still a big debate. I mean, the question is again, is fasting and all that stuff, AMP versus mTOR. It's kind of not right now. We find that the studies are showing that the growth hormone peptides are actually, you still can put on mass. It's not a concern with mTOR. Again, you may want to be cyclic with it. So if you're patients who do want to try to put on muscle, it works well. So I think that's beneficial. The one that works on AMPK, which is MOTC, we only do for 2 months, so we don't want to hyperstimulate the AMPK. We'll do that as well. And then again, you can always kind of, everything's specific. That's why you want to first, quote unquote, make sure they have the right stack. For those, stack means combining certain peptides and other supplements so they work better together than separately, but you're also rotating things on and off. So you're not just hyperstimulating the same pathway on and off for months and months and months. You want to, I mean, most things except for BPC, I don't do more than like maybe 3 months for any patient. And then we're switching off to other things.
Okay, interesting. And I guess actually one of the questions I had coming back here, well, a couple, is on hair loss, because you sort of mentioned that in passing, and red light therapy, for example, has been shown in some studies to help with that as well. What have you found in terms of like that combination plus the peptides? Because sometimes people seem to have obviously a genetic predisposition to hair loss. It can be linked to other things, for example, like iron deficiency in menstruating women as well, for example. But it is a really, really common thing that people have thinning hair. Have you found that there's certain stats that work with men versus women? What have you found in that regard?
No, it's become, at least here in New York and LA, the big metropolitan areas, that's become really part of the go-to treatment for hair loss. I mean, obviously, no matter what, you're looking for the root cause of it. Again, is there a thyroid? Are they iron deficient? Are they not absorbing with the gut? You obviously want to rule that out. Otherwise, you're kind of just chasing your tail and charging these patients money for something that they may never fix. But otherwise, yeah, in terms of cosmetic treatment, it's usually a combination of injectable or IV thymosin beta-4 with the use of PTD DBM.
Dr. Paulvin, sorry,
Yeah.
can I ask you to, can you hear me? Sorry. Can I ask you just to repeat that in terms of hair loss and the go-to? Because I think the connection literally just dropped. And so I didn't, after you said in LA and New York, I don't think we heard it.
Okay, sure. In LA and New York, it's become part of the go-to cosmetic hair loss treatment. It's a pretty comprehensive cocktail at this point, where we're using the red light, either the red light helmet or a red light panel, with doing a combination of 4 peptides, which is thymosin beta-4, usually injectable or IV, with 3 that you can microneedle, which is PTD DBM. Then you have GHK copper and zinc thymolin as a combination. You're injecting that as a kind of a microneedling, or we'll inject right into the scalp. And then the other thing that's become really big here is what are called exosomes. Exosome is kind of superseded with PRP, or platelet-rich plasma, which is blood we draw out and then spin it in a centrifuge to purify it. We find much better results with that. That's been the highest end cocktail, and we've had really good success. It's still something that you have to do every 3 to 6 months. It's working better in women, and doing better in men than women. With women, you definitely, I think with women, unfortunately, a lot of times if they're having the hair loss, it could be much more hormonal issue, be it female hormones, be it thyroid, be it iron deficiency. So you have to really work on somebody like, not somebody like me who does the anti-aging, but also understands the functional component of it. Some of the dermatologists or plastic surgeons just, okay, I'm going to inject your head with this, and aren't fixing the other part of it, and it just doesn't work as well. I'm one of the few people who kind of has both buckets, or it works really well. It's growing and growing. I think the advance of red light is getting better and better. It's great that they can do something more naturally, as opposed to having to take thousands of dollars of medication.
Mm. Yeah, it's interesting as well, because the PRP actually works very well as a facial treatment as well, doesn't it, in terms of stimulating collagen production. In terms of the red light, have you seen differences between the cap, which is obviously much closer to the hair follicles, compared to panel use, or are you just getting kind of patients to sort of lean forward? Because obviously if you've got hair, right, and you're just trying to thicken the hair, it's slightly different, isn't it? If someone's got a bald head, to sort of move it nearer.
The cap, a good cap is much better. I mean, but it's, I mean, at least by here, the good caps are pretty expensive compared to the panels. So if, but the caps are better. Heads down.
Yeah, no, I can imagine. Okay, cool. And so what's exciting, before we close, what's exciting, what's new for 2021 that you are observing? You mentioned a few things in passing there, but what are you most excited about in terms of integrative and medicine and longevity?
I'm excited about two things. I'm definitely excited about the mitochondrial peptides and all the research that's being done to help boost the mitochondria and the association that we're having with systemic disease, that we're kind of moving away from, okay, it's Alzheimer's, we're just going to work locally. We're now going to try to fix the problem. I think that's great. There's a medicine that's kind of gotten a little more play here, something called spermidine. I don't know if it's big over in Europe yet, that boosts autophagy and muscle growth, and has gotten really good effects both for the general population who's trying to boost health and performance, and also, again, in patients who have chronic illness. And then I'm really excited for two other things. One would be some of the tech that's coming out, especially some of the transcranial stimulation, some of the technologies coming out for both anxiety and depression, and also for pain. I do have a lot of pain patients in my practice, and if I can treat them by doing either the transcranial stimulation or VR, virtual reality, which is, I've tried some of the new units that are coming out and they're incredible. That's a win for me, that patients aren't going to be addicted to opioids and other medications and have all the side effects you get. I think that is, a lot of it got delayed, unfortunately, with COVID, and now hopefully as things kind of finally open up again, you're going to see a lot of cool technology that got bottled up last year because nobody paid attention to it or got bogged down in technical stuff. And the last thing is, I think plant medicine, at least here in the US, I think in other places as well, is going to be huge within 3 years, kind of the way that CBD was a couple of years ago.
Yeah, I agree. Interesting. That VR that you mentioned there, that I'm curious about that. How does that work in terms of managing anxiety and depression?
They're finding that they've done that either some will have just specific reprogramming of the brain through the program that you're watching. Some are much more complex, will have a specific, I don't know what the word would be, a specific piece that's on a certain area of the brain to help regulate the brain while you're doing a specific program. They're much more complex and expensive. Some are more just, they find that if you do a visual plus the hearing of a meditation or some type of mindset program, that since you're having access to two senses, both the audible, because obviously you can hear it, and also seeing something at the same time, they find that it works well. And a lot of chronic pain patients they've done a lot of studies now, post-surgical patients where they had a much lower need for pain medication than people who didn't do the VR. So there's a whole spectrum of what's out there now. Some are very basic and less expensive. Some are really more for chronic pain patients. They're going to be more expensive, but have be much stronger.
Interesting. And does it use things like neurofeedback then alongside it?
Some are part of the studies. None of them do neurofeedback. That's a totally separate entity right now.
Okay.
I love neurofeedback. It just here, at least here, it's very hard to find somebody who's very qualified in doing it. But I love neurofeedback. I think it's a great technology.
Yeah. It was interesting when I was interviewing the founder of Mind Lab, who'd kind of connected an extra piece that went with the Muse headband. So it was an extra sensor that you can use alongside, and then allows practitioners to work remotely, neurofeedback practitioners to work remotely with people, so they didn't actually have to come into clinic. Quite interesting, just to make it more accessible to people.
I gotta check that out. That's cool. I didn't know that. Cool.
Yeah, Aziz, I'll send you after this the details.
Awesome.
Exciting. So in terms of, you obviously work remotely with a lot of patients. Do you do, presumably, and I'm pretty sure I've seen it on your website, you do online consultations with people. Is that worldwide?
Right now, it's not worldwide. I mean, we're discussing programs. I've got, because of social media, I'm getting requests from all over the world now. What we're working on for Europe and Asia is a protocol and program that I can do there. I'm not licensed there, so I can't give medical advice. Can't give I can't prescribe medications or anything, but I can develop a program for a general program and recommendations where they will work with their own provider. We now have a kind of a list of providers in most countries that you'll work along with on the protocol that I'm recommending, especially in England, Germany, and I think in Spain and Portugal right now. We already have like practitioners that we already work with to kind of augment that. It just, we don't know what, I know things are legal here that are not legal in London or England and vice versa.
Mm-hmm.
But yeah, throughout the US, I do telemedicine and work with patients through all different things, because now everything is, I can mail everything to almost every state in the country.
Amazing. So shout out, how can people find you? I know you're pretty active on Instagram. You're also on Clubhouse quite a bit recently, I've noticed, giving talks, and your website. Can you link so everyone can kind of find you?
Yeah, I mean, the best places to reach out to me is, if you want to email me, is through the website. Dr. spelled out DOCTOR, my last name Paulvin, PAULVIN.com. Otherwise, if you just want to check me out and want to get more information, Instagram, the big two things I use, Instagram, and I am loving Clubhouse because it's pretty much like it's a free it's a webinar without having to pay and do all the Zoom stuff. You can just, I mean, you get to interact with this great practitioner. I've already hopped on with a bunch of different really great other practitioners who I never would have been able to co-work with, and it's great. So definitely check me out there too. I'm just Dr. Paulvin on everything else.
You don't even have to get dressed for Clubhouse either, is what I find, because it's audio only. That's one of the benefits, I think.
Everybody's loving that, especially like my wife's on it now, and she's a doctor. She's like, yeah, I don't have to do my hair, do my makeup.
Yeah.
And I have a friend who's one of the big hosts on a lot of the big rooms, and she's like, yeah, I can just do it in my sweatpants and my bun, and I'm good to go. So.
Exactly. The only thing I'd say is it's addictive. When you go on there, it's kind of hard to come off, and some of the conversations last quite a long time, but you can learn a lot.
Exactly. Now I've gone through my initial burst. I have to okay, I'm going on for an hour, and now I'm going back to work, because otherwise you'd be on forever.
Yeah, for sure. But it's a great place to make contacts with other people as well. We will link to all of that in the show notes. So thank you so much for coming on and sharing that extensive knowledge. I feel like we did a bit of a whirlwind tour there of everything that you know. So I think we probably have to invite you back, if you'd be up for it, to go into one area probably in a bit more detail. Lots of exciting stuff for people to get their teeth into.
Would love to come back, and it was a really good time. Like talking this stuff.
Yeah, no, it's very cool. Thanks again.
Thanks a lot.